my name's Christina Matousek. I've been an oncology nurse at Smilow Cancer Hospital at Yale New Haven Hospital for about 15 years now. I've worked in all aspects of oncology, inpatient oncology, medical oncology, private practice, infusion, surgical oncology, and my most recent job was with Smilow Nursing Education and Practice. And so an opportunity presented itself. Our previous VP of nursing had obtained a grant to start an ambulatory fellowship program for new graduate nurses. And I jumped at the opportunity. I work also at Sacred Heart University as a clinical instructor and simulation instructor. And so I was really inspired to help create this type of program to allow new graduate nurses to enter ambulatory oncology right out of nursing school. I really had a lot of support with building this type of program. I really didn't know where to start. Just to preface it, this was funded by a grant obtained from the Frederick A DeLuca Foundation. So we're super grateful for their support. But in the beginning, I really just sought out the literature and what other areas of the nation have implemented this type of program. I worked a lot with various cancer centers across the country. Some of the big ones that really helped me a lot was Duke Cancer Center. Special shout out to them. Carla and Cindy were amazing with this. They had also implemented this type of program at their institution. And so I really had a lot of support from various individuals throughout the country to get started with this. And so after I really kind of learned from them and learned best practices of what was successful at their institutions, I sought to emulate a lot of what I learned from them, as well as catering it towards our institution. So our fellowship program is 9 months in length. It really starts with about 6 months where individuals will rotate through different areas of ambulatory oncology, focusing on the infusion areas. So I built their orientation specifically to really emulate the experience that the oncology patient goes through while they're getting cancer care. So they have not only specific preceptors to the different areas where they're learning, but they also have relevant shadow experiences built into their experience and orientation. At around the 3-month mark, they will actually go through the ONS's chemotherapy, immunotherapy provider card course, and then they will also go through our own chemotherapy skills course to ensure that they're competent, at least to begin giving chemotherapy. Throughout the fellowship program, we meet with them once a week to ensure that they have the support that they need, and to really look at any type of, to really look at their competency level as well as confidence level. We do survey them every 3 months to gauge where their knowledge levels are on certain avenues of oncology care. So for example, peripheral IVs, central line maintenance, onc emergencies, things of that nature. We spend some time actually ensuring that they are feeling better as they progress through the program. And we really have seen across the board in every aspect that we survey, we've seen 100% improvement in all the different areas, according to their self-assessment. But observing them on the unit, it's very evident that they feel more comfortable as time goes on. We've had our first cohort graduate in April. So they went through a whole 9-month program. Like I said, the first 6 months are rotating through a few different areas. And then the last 3 months is where they're actually going to orient to whatever area they're hired to. So we help facilitate a position within our cancer hospital based on availability of what positions are out there. And they orient for another 3 months to that specific area. So we had 6 individuals in our first cohort. We are funded for 6 people per year. So all 6 of them completed the fellowship program, and they are currently off orientation and in their respective units. We did do a little celebration ceremony for them as well, which was really nice to see, had their families come and just to be able to recognize just all of their hard work. We have our second cohort that started in February. We're actually doing 2 cohorts in the year of 2024, 3 and 3, just to break it up a little bit, and capture those new grads that graduate in December. So we had our second cohort start in February, and we are in the process of interviewing for our third cohort, actually this week. So we're excited for them to start hopefully in July. The other aspect of this program is that we're also doing this for APPs as well. So that has not started yet. We're in the process still of building that program, but we're hopeful that that will start in the fall of this year, where we have 3 APPs that will go through a similar process as the nursing staff did, but just geared towards that advanced practice. So I'm really hopeful that this program will continue and people will continue to be excited about it. We've had a lot of applicants and a lot of interest over the past year. So super excited about that. It's been great to see it be very successful. And I'm hopeful that at the end of our grant period that either we get funded for more time or the hospital will choose to adopt this program because it has been successful and there really has been a great need for it. The advice I would give people is to really look what's out there in the literature as well as connect with other individuals throughout the country. People have already started implementing these types of programs and have been successful. And it's an opportunity to learn from what they found to be beneficial to their staff and what was maybe not so beneficial. So I think starting there definitely, as well as really getting buy-in from the key stakeholders in your organization. It was a little bit of a challenge to have people actually accept that new grads can start in ambulatory oncology, as that's really a culture shift for our organization. So really just ensuring that you present the literature and the facts of what they are now, and that there's such a great need for this, that if you can get buy-in from your upper level leaders as well as your bedside nursing staff, it really has proven to be successful and people have really enjoyed it. Our preceptors have, who were somewhat skeptical at the beginning, are, very into it. It's almost brought new energy into ambulatory oncology, to have new people that are excited to be here, that want to be here and want to learn from them. So I think if you're able to really present it in that way, that will be super helpful for getting your program started. I think that it's been great to really just connect with people who across the country. It's been really nice to share this work. It's also just been humbling to just hear how excited people are and wanting to start this type of program at their organization. So I think that you know they shouldn't hesitate to do so. It will probably really like bring life back into outpatient and really get people excited again about caring for these types of patients.